Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with cardiologist Dr. Sivaji Gundlapalli about cardiac arrhythmias. Dr. Gundlapalli, what are the common types of irregular heartbeat?
There are bradyarrhythmias, or slowing of the heartbeat, and there are tachyarrhythmias, where the heart goes faster than 100. And among the tachyarrhythmias, there are that arise from the top of the heart, or we call them supraventricular tachycardias. There are also other varieties called atrial fibrillation and atrial flutter. There are arrhythmias that come from the bottom of the heart called ventricular tachycardia and ventricular fibrillation. The arrhythmias that arise from the bottom of the heart are more dangerous to the life, whereas the ones that arise from the top of the heart are not as dangerous but could be significant too.
So they might not result in immediate death, but there still might be problems with it. Well, let's talk a little bit about atrial fibrillation. What is it?
Atrial fibrillation, one of the disorganized arrhythmia of the heart, where the top of the heart starts beating 400, 500 times, and it's very disorganized. And the coordination or synchrony between the top chambers and the bottom chambers is gone. And the bottom of the heart beats faster and irregular. That's what atrial fibrillation is. We can look at an image. We can see.
Let's do that.
This is the normal EKG, where there is a nice synchrony between the top chambers and the bottom chambers, and heart rhythm is very regular. And whereas in atrial fibrillation, you can see the activation of the bottom of the heart is happening at different intervals. It's a long interval, a short interval, and it's fast. And also you can see the top chambers have also activity, but they have more activity in the top chambers of the heart compared to the bottom, and the synchrony between the two of them is gone.
Who's at risk to develop this?
Well, it's becoming a disease of age. The more elderly you are, the more risk of developing atrial fibrillation. And having other heart problems like hypertension, diabetes, cardiomyopathy, congestive heart failure, all make you prone to get these arrhythmias.
So do those things actually cause the atrial fibrillation?
Both ways. Having those diseases make you prone to get atrial fibrillation. Sometimes having atrial fibrillation may lead to congestive heart failure.
Okay, so how about signs and symptoms? What is that patient going to feel like when their heart is disorganized like that?
Yeah, surprisingly, some of them could be asymptomatic.
Really?
So, yeah, the other day I have seen an elderly female who had a routine EKG to have a surgical procedure, and she was found to have atrial fibrillation. She didn't have any symptoms. But majority of the time feel irregular heartbeat, fatigued, tired, short of breath, sometimes dizzy, fainting. Those are all the symptoms they can experience.
Is there sudden onset of atrial fibrillation?
Yeah, sometimes it could be intermittent. It could last only a few minutes and then stop. Sometimes it could be sustained, lasting hours, or it may be constant. But when it starts, the starting point is always a certain point.
So which makes me wonder, how can you diagnose it?
Yes. Well, if they are having symptoms, if they come to the office and they're in atrial fibrillation, with the EKG we can find out. But if it happens intermittently and the symptoms are coming only from time to time, then we have to use a different kind of monitors to diagnose them. The monitors could be what we call event monitors. These are the monitors that we can wear for a month, and these systems will record when the heart goes into irregular rhythms. Or if you have symptoms, you can push a button and then records it. We can diagnose that way. And sometimes we have what we call loop recorders that we can insert under the skin, and they stay there for up to 3 years, and they can sometimes help us diagnose this problem.
Do patients, like let's say they were an event monitor for 30 days, do they always have an event during that time? Does atrial fibrillation happen frequently, or can it happen very infrequently?
It could be. Most of the times, if it's happening frequently, maybe we'll be able to diagnose with the EKGs. Most of them, these are required when it's infrequent.
Okay.
That's how
So it is sometimes a little bit difficult to diagnose when there's no symptoms and it doesn't happen on a regular basis.
Yeah, it is challenging sometimes.
But so then that leads me to, what happens if you don't treat it? If it's infrequent, it doesn't happen very often, you just kind of say, well, it's not a big deal, I don't need this treated. Is that true?
No, because atrial fibrillation undiagnosed can silently lead to the problems. Sometimes it can weaken the heart muscle, and you can get congestive heart failure, or you can form clots in the top chambers of the heart. Because when the heart is in atrial fibrillation, the top chambers of the heart are not pumping, blood can pool and stagnate and cause clots like this. And those clots can migrate and cause problems. The migration could happen to the brain and cause strokes, and sometimes the migration can go, the clots can go to the legs, cause ischemia of the legs, cold legs and all that. So if you untreat these arrhythmia, it can lead to serious heart conditions.
Okay, well, we're going to take another break, and then we're going to talk a little bit about how do you treat atrial fibrillation. But first, this message.